Welcome to Smile by Design, an inside look at the art and science of cosmetic implant dentistry. Brought to you by Palm Desert Center for Advanced Periodontics, Cosmetic, and Implant Dentistry. Our topic today is what you need to know about dental implants. If you have loose-fitting dentures or you have lost one or more teeth, then my guest, Dr. Ann Nicholas, the most renowned periodontist, has some valuable information to offer us. Tell us about your practice and what type of patients you see.
This year we are celebrating 20 years at the same location, and the type of patient we see at the practice are patients that lost all their teeth, denture wearers, patients that lost one or multiple teeth, patients that have periodontal disease and they're afraid to do something and they don't know what to do and what are their options. They have bad breath and they don't want to remove their teeth. And sometimes they wait too long till they lose all their bone. There are patients that need treatment for gum recession or gummy smile so that they have a beautiful smile.
In your center, you work together with Dr. Adam Keach. Tell us about your teamwork.
Our practice is unique because we have a team of specialists at the same location, and this way we can coordinate treatment much better for our patients, because this way a patient doesn't have to go from one office to the other office, and they don't like to do that. They want to stay in the same place, but at the same time we're able to provide for them the highest quality service at the same location. And I'm in charge of doing the surgical part for our patients, while Dr. Keach is in charge of making them a beautiful smile and making them look beautiful.
Dental implants changed over the years. What is new about it?
I'm very excited about the changes with dental implants in the dental field, because never before you're able to replace teeth with real teeth that look like real teeth, feel like real teeth, and chew like real teeth, which are dental implants. And what happened is that this way, by placing an implant, you preserve the bone in that location where the tooth is gone. So you don't make a one-tooth problem into a three-teeth problem and grind down 2 additional teeth to put a bridge, which would be harder to clean and would need to be replaced periodically every 5 to 10 years because of the bone shrinkage in the area where the tooth is missing. There are advanced grafting techniques that you can rebuild the bone in height and width. There are morphogenic proteins that are processed by the body.
Okay.
So there's a lot of new advancement every few years. This is a rapid improvement in what you had done a year or two before. So you need to keep up with everything that's going on.
Sounds like there's been a lot of changes.
Right.
You say imaging has changed and it helps with downtime.
We use CT scan for diagnostic and for planning of the surgery. So this way we can place the implants in more accurate position. The incision of the surgery are much smaller. The surgery takes a shorter time, and that makes a positive effect on healing, because you heal faster and there's less pain because the wound is open less and it's smaller. So the time of the surgery, instead of having a surgery that lasts 5-6 hours, can be 2-3 hours. So that's a big advancement, and most of our surgeries are CT scan guided surgeries.
You mentioned to me in the past that dental implants change people's lives.
That's an understatement, because many patients tell me that they wish they would have done it sooner, and they wish they would have had a trial period. If they would have been able to try it just for one day, there would have been no way that they would have chosen something else, or they would have gone back to what they had. They don't realize the dramatic change and that dental implants will make, and the change is immediate and very powerful. So out of a sudden, they can eat with confidence. They can chew whatever they want. They don't have to use the denture adhesive that doesn't taste good.
Why did you decide on dental implants instead of a removable partial?
My mother lost a lot of her teeth, and she ended up with some partials and also a denture. And I always swore I would never, ever have the glass by the bed with the partials in it. I just, that's not something that was even a consideration for me.
What type of treatment did you have?
I needed quite a bit of work done. I had been sent to another periodontist. He was recommending a lot of work, and I wasn't comfortable with him. So I was searching around, and I found Dr. Nicholas. I had several dental implants, both on the top and the bottom, and then I had periodontal treatment, and also she recommended I consider having my front teeth a smile makeover, so to say. When it was finished, it was beautiful, and I've been happy ever since. After the periodontal work was done, and also the implants, we discussed my smile, and Dr. Nicholas pointed out that my teeth were short, and I hadn't realized that before. Then I decided to go ahead and have the smile makeover. And she has a specialist who's right in her office, so I didn't have to go to a new place, and I was able to meet the prosthodontist before I had the work done, and I decided to do it, and I am thrilled with the results. So now I can smile.
What was the key factor that brought you to Dr. Ann Nicholas?
Like I said, I wasn't comfortable with the periodontist that was recommended by my dentist. He was doing too much, he was going to do too much work. I didn't like the quotes for how much it was going to cost. And so I started looking around, and I saw Dr. Nicholas, and I went over to her office in Palm Springs and spoke with her and liked her immediately. In fact, my nephew in Florida is a dentist there, and before I had this treatment plan, I took him both plans, the one from the previous periodontist and Dr. Nicholas, and I had him review all the plans. I took my x-rays, and he said that Dr. Nicholas's plan was excellent, and that would be the way to go.
How long did the treatment take? Was it painful?
She did all of the implants in one treatment, and she even had to rebuild some of my sinus bones. She did it basically in one day. The healing period was about 2 weeks, and I was very comfortable all the time. Dr. Nicholas has called me many times personally to see how I'm doing, and I really appreciate, like I say, that kind of family kind of feeling. I look forward to going to her office and seeing her staff, because they are all such wonderful people.
So the denture wearers benefit the most from dental implants?
Yes, because with dental implants you can secure now the denture to the underlying tissue so it doesn't move around. And when you don't have those implants, what happens is that the bone shrinks underneath, and then this is how dentures end up being relined. And I've seen many patients that after having dentures for 40 years, the part that was added, relined to the denture to compensate for the bone that was lost, it's sometimes 3 times as much in what's left.
If dental implants are as good as you say, then why isn't everybody doing it?
Because there are many misconceptions about dental implants. Besides, they forgot what it is to have your own teeth and chew with your own teeth, because they have the bad experience immediately after the dentures were delivered. Mm-hmm. So they're unhappy the first week, then people have a nature to get adapted and living for the rest of their life with a disability, basically.
They just become immune to it, and they just learn to live with it and just move on through life with that.
And there are misconceptions about dental implants there that you need an implant for every tooth. So for example, if you have an edentulous jaw, and initially there were 14 teeth, you don't need to put 14 implants to restore and have a fixed restoration. You can have 6 on the bottom, 8 on the top, and you can have something fixed that doesn't come out, and they feel and like their own teeth, they chew like their own teeth, and
so they have
feel
the
better than what they had before.
Okay, so they do have the luxury of not having to do the 14, but it could be the 6 or 8, and everything could be achieved.
Then, when they believe that there are going to be so many implants, then they say, oh man, this is going to be expensive. I can afford to spend that kind of money. When you look at the cost and you compare over a period of 20 years, all the denture that you replace and reline, or bridges that you have to redo every 10 years because of the bone shrinkage and all that. Dental implants, if it's done right at the beginning, when you still have the bone and you don't have to go through additional surgeries to rebuild the bone and go through the cost of all that, people don't realize what a dramatic change. And 3 months later, you have something that doesn't move around, that it's fixed, and it's better like when you had your teeth 30, 40 years ago.
Well, it's good that you're getting this message out so people understand the pros and cons, and it sounds like everything is a win-win for them.
Right.
Well, I'd been going to another dentist and had some really bad things happen, and I was looking for someone new, and I was actually reading Palm Springs Life, and she had an article. And I read it, I liked what she said, and called up and had a consultation. Well, I needed an implant. I had some crowns done, and I had some surgery for gum disease.
So what did you do before you had your dental implant treatment?
Well, I had a tooth that had a filling, and the filling came out, and then the tooth broke off. And I didn't get to the dentist fast enough, and by the time I got to Dr. Nicholas, it was to the point it needed an implant.
Does the implant feel different than your other teeth?
Absolutely not. Feels just like my normal tooth. It was wonderful.
What about the pain? Should people be afraid?
No, because I am a big chicken, and I was out more or less, and it was not painful even when I went home. It really, I think I had one pain pill. Other than that, it went great.
So with your new dental implant, is there anything you're afraid of eating?
No. It took me a few days to realize I could actually chew on that side again because I hadn't been able to, but no.
How long did your treatment take?
It does take a few months. I started in October and finished in May, but it was definitely worth it.
What do you think about Dr. Ann Nicholas?
She's fantastic. Absolutely fantastic. I couldn't say enough about her.
The two biggest misconceptions is that, one, people are too old. They think they're too old to have implants. And I have people that are in mid-60s and choose to live their golden years being miserable and putting up with those dentures that move around and using all this denture adhesive.
Well, again, I'm glad you're getting the word out because I think it's a great procedure.
Right. Then the other thing that I hear people say many times is that they say, oh, implants is a very aggressive treatment.
Really?
It's more aggressive surgery. And it's totally incorrect because when you have two virgin teeth that don't have a filling, don't have anything on them, no crowns.
Just clean teeth.
Right. And you grind them down
to
put a bridge. It's more aggressive than because you're making a 1-tooth problem into a 3-teeth problem.
I see.
Okay? When you place an implant, they preserve the bone and you don't touch the adjacent teeth. And it's easier to clean. So it's like you got your tooth that you lost because of fracture or decay or whatever, you get that tooth back.
Oh, wow. Okay, so then...
And it's not painful because they're asleep. Dental implants is the most successful surgery on human body. Here's the thing. We treated hundreds of people. None of them would consider going back to what they had before.
Oh, fantastic.
It's amazing. And what is nice with our team of specialists under one roof is that we can provide the best results because when the bone shrinks, you need to compensate for that collapse.
Okay.
And to make for the bites and the condyle. There's a lot of things to take in. So this is advanced reconstruction in terms of to accomplish the best result. And as a team, when I work with Dr. Geach, we have good communication and we can deliver fantastic results. It's going to last.
When I first started with Dr. Nicholas, it was actually, my wife had gone to see her first. And after that examination was over, she made an appointment for me and I came in. And I had several problems with my gums, teeth that needed to be pulled, several problems in my mouth. I just let it go. And so Dr. Nicholas was kind enough to take me from square one, explained everything, was very thorough with everything, and we began the process.
What type of work did you have done?
I had 4 major surgeries. Each quadrant of my mouth was cut open and dealt with. I had gum disease real bad. I had teeth that were lost. I had 3 down here in the front that were totally crooked, and they were in real bad shape. They were loose. And after about 3 or 4 months, all my bad teeth were gone. Did a lot of bone work around several of the teeth to keep them, and they're still with me. So that's a positive thing. And now it's the implants were done, and I've got all my teeth in my head, and I can now eat apples again, which is my favorite fruit. My front 3 teeth were very loose before this process started, and it wasn't only apples, it was I could eat a sandwich and worry about those teeth coming out of my head. So this whole process has given me back one of the things that I love most in life, and that's eating again. So thank you, Dr. Nicholas.
Tell us about the discomfort. How long does the pain last?
In terms of it being painful, I'm a big sissy when it comes to surgeries, and it's discomfort. I'm not going to lie to you. It is discomfort. A little bit of pain. The first night, the first 2 nights are the worst, and then you wake up on the 3rd day, and most of the pain is actually gone. The mouth heals very quickly, so I've found. So the pain and discomfort really isn't all that bad.
So I understand that Dr. Nicholas performs surgery by salsa.
There's all kind of music going on in her office, but yeah, I believe that there was salsa in there, mixed in at times too. And she also sings while she's doing surgery, so yes, she's very entertaining as well.
Comments about the staff?
Dr. Nicholas, not only was she kind and gave all the information prior to, from the cost to what was going to happen to the whole entire process. Her staff, the Amanda that works the counter, what a doll. They're all fantastic people. The assistants that were in on the surgery were very comforting, very nurturing during the whole surgery. I can't say enough about this office. If you folks are out there wondering, should I have this done? Please, you owe it to yourself to at least get the examinations, to at least find out what it's going to cost, what it's going to do to save you, because I do definitely believe that this has made my life, not only my health, but my life much better. So in the long run, please, if you need dental work, see this lady, she's top.
I see you brought some models.
This is a denture that it's anchored to implants, to 4 implants that get support both from the implants and the tissue below, and that's snap in, snap out, and it's pretty tight.
May I see
Check
it?
it out.
Thank you. Wow, that is tight. Yeah, very good. So this is a snap-in.
Yes. Then we have another model, and this model has 5 implants with a bar. So what this bar is doing is that as long as you have those 5 implants here in the front, you can have those wings that are helpful in the area where I showed earlier on those models that the bone in the back is gone. So it stabilizes the denture. So this denture in this situation sits on the bar, and this bar prevents the movement to the left and the right, and also up and down, because if you didn't have those wings, then it will rock in the back.
Very interesting.
The more implants you add, the more stability you get, and you can make actually with 6 implants to 8 implants, you fix prosthesis that does not come out.
No movement, everything sits perfectly flush, and you're good to go.
Yes, and then this is what people like, because it's psychological. When you have at night to take those teeth in and out and clean them, or when they're part of you, that they don't come out, then people feel better about themselves. They feel younger.
Their whole attitude changes,
Yes.
is what you're saying. They just
Yeah.
feel more vibrant. Everything seems to be
And
better.
those teeth feel to them, they tell me, better than their own teeth that they had before, when they had teeth.
So you do have testimony about that they are saying it's better than what they've had.
Yes, definitely.
Fantastic.
And they say, if I knew then what I know now, man, I would have done it from the beginning a long time ago.
So it's just a matter of getting somebody in so you can explain the process so they can have an understanding of what it is, and a lot of these people then would have this done a lot sooner.
Right.
Excellent. So that all being said, what is your final message?
For patients that wear dentures or are missing one or multiple teeth, or they don't like their smile and want to improve their smile, don't hesitate. Take action, give us a call, come on in for a no-fee consultation and find out what your options are.
Thank you, Doctor.
My pleasure.
This was both educational and enlightening. We have with us today Dr. Adam Keach, a board-certified prosthodontist who practices with Dr. Ann Nicholas at the Palm Desert Center for Advanced Periodontics, Cosmetic, and Implant Dentistry. What is prosthodontics?
Prosthodontics is one of the 9 dental specialties recognized by the American Dental Association. So like orthodontics, which deals with braces or moving teeth, prosthodontics deals with prosthetic dentistry.
How do you become a prosthodontist?
Well, prosthodontists will train for 3 additional years beyond dental school in a residency program, and so our study focuses on aesthetic dentistry, implant dentistry, crowns, bridges, dentures, and also full mouth restoration cases. So we study the bite, or as we call occlusion, and how it relates to the joints. I think one of the things that sets us apart is our ability to plan cases, and we also spend a lot of time designing and fabricating the restorations ourselves.
I understand that you are board certified.
Well, board certification, just like a plastic surgeon becomes board certified or a cardiologist becomes board certified, prosthodontists can also become board certified in their specialty. And what it means is that you've achieved the highest level of expertise in the field.
What is your role at the Palm Desert Center?
I work with Dr. Nicholas, and we provide 2 specialties under one roof.
Dr. Nichols says you make the teeth look real. Can you walk us through what real means?
Any dentist can make a tooth, but to really make a tooth that mimics a natural tooth, you got to spend a little extra time noting the little characteristics and the details within that tooth and communicating that information to the dental lab, the ceramist. And we do that through digital photography. Sometimes I even will take the patient over to the dental lab so that the ceramist can take a look at the patient's shade and the characteristics of their teeth to be able to mimic that with the final restorations.
She says you are changing people's lives. Is this true?
I think we change lives every day. I think if it's a patient who is missing a single tooth that is being replaced by an implant, or if it's a patient that has lost all of their teeth and we're replacing all their teeth with a prosthesis or with dental implants, the change is immediate. The patient immediately is able to function better, is able to present themselves better, and the quality of life is improved.
Are dental implant patients the happiest patients?
I definitely think they're the happiest. If you can imagine trying to chew with dentures, loose dentures in your mouth, something that moves around, attempting to eat the foods that you enjoy the most is extremely difficult. When you're able to solve that problem for them with the placement of dental implants to secure those dentures, then the impact is immediate.
Do patients tell you they wish they would have done this like years ago?
They definitely do. I mean, when they can feel that difference, they wish they could have done it 20 years ago.
What's new in your field in restoration?
There's lots of new technology over the past 15, 20 years that has moved along with dental implants. The one thing is that the dental implant technology has improved. So the surface of the implant has changed, which allows the implant to heal into the bone quicker than it used to. So that means reduced healing time for the patient. It also means that sometimes, depending on the case, we can immediately restore the implants at the day of surgery, which also is more comfortable for the patient because they no longer have to wear a removable denture There's other technologies where some of the final restorations that I'm designing can be made by a computer, and it's manufactured digitally. There's a lot of exciting things in dentistry which are just making it easier to treat patients and making it a more efficient process.
It sounds like you came in at the perfect time with all these new techniques and processes and
Yeah,
everything.
luckily
Very
I did.
good. Do you enjoy what you do? I mean,
I really enjoy the art and science of dentistry. I think that's the reason why I became a dentist in the first place. I think it's why I became a prosthodontist, because we have the special ability to plan, design, and then fabricate the restorations ourselves. So there's a lot of creativity. There is science involved with it. The whole process and how it all comes together is what I enjoy the most, and really coming up with a nice solution for the patient.
what types of patients do you treat?
A wide range of patients, mostly adults, but sometimes we treat children. Some children have some anomalies with their teeth that can be improved with prosthodontics, but most of the patients are patients who may just need a filling or a single crown, all the way to a patient who may need a complex restoration that involves all the teeth, where we may have to crown all the teeth or change the position of the bite, and also patients who have lost all their teeth. We make restorations that are supported on implants.
What is cosmetic dentistry?
Cosmetic dentistry refers to any dental treatment that enhances the teeth, the gums, and the smile.
What goes into the design of a smile?
One of the first things that I look at is just the face, the position of the nose, position of the chin. I'm looking at where the patient's facial midline is, because I want to make sure that I create a dental midline which is coincident with the facial midline. That's one of the things I look for. The other thing is the level of the pupils. Are the pupils horizontal? Are the eyes horizontal? Because I want the plane of the bite to be horizontal to the patient's eyes. Then is the frame of the smile, and how high does the patient's upper lip move when they smile? How much gum do they show when they smile? Where is the position of the edge of the teeth when they smile?
How do you avoid that big teeth look?
Well, it comes down to really studying the patient's smile. Every single tooth has a particular height and width dimension that needs to be followed with each tooth in order to make it look like it's in proportion with the rest of the smile. So if you follow those guidelines, then you'll be able to avoid that big toothy look. The other thing that we do is, before we start treatment, we will perform a diagnostic wax-up on a cast to show the patient what their teeth are going to look like. When the treatment begins, we use temporary restorations on the teeth to mimic what the final restorations are going to look like. And then we can make any adjustments or changes depending on what the patient wants.
This has been very informative. Thank you so much, Dr. Keish. Pleasure meeting you.
Thank you.
Until next time.